children's gut microbiomes impact their future development. And
Yes.
as you mentioned, the immune system, even from, of course, babies, but the way that they're birthed, the even, their experience in utero and the way that they're fed initially, that's going to inform how their gut microbiome develops. And we know that there are certain signatures in their gut microbiomes now that we can see increase the risk for things like eczema or ADHD or autoimmune conditions. And so we're finding these signatures. And when there's disruption to the gut microbiome, so this one study of nearly 800,000 children, it was a military study, that tracked these children from birth to about 4 years of age, and found that those infants who received antibiotics or antacid medications, which are two immediate disruptors to the microbiome, within the first 6 months of life had an increased risk of virtually every single allergic disease, like eczema, asthma, hay fever, anaphylactic food allergies. There's another study in Denmark, which is, they also keep very good records of their population. And so,
Right.
a huge study of mother-infant pairs, and then tracked these infants through time and found that even just one round of antibiotics at any age could increase the risk of mental health diseases, conditions in that child when they were older by up to 50%. The highest risk was when those antibiotics were received even in utero or under 6 months of age. So again, the early priming.
Earlier, the more detrimental. Yeah.
Yeah, and then the more rounds of antibiotics, the higher the risk. And so any disruption can then have, like we've been saying, this ripple effect on their metabolic system. The rise in type 2 diabetes in children is astonishing. And the rise in pre-diabetes, even in these kids, these teenagers and young kids who look fit, they're exercising, they're on sports teams, they're not overweight. They don't look like the pre-diabetes picture. But when I measure, they're fasting insulin and they're fasting glucose, it's not okay. I mean, their insulin is bumping up against 15, 16, 17.
And Elisa,
right?
quick clarification question there. Do you think this tracks, or is it becoming divorced from caloric intake? Because one of the things I've been noticing in adult populations is at one point there was a direct correlation if you were to draw out caloric intake and, let's say, BMI as sort of a crude Gen Pop screening, they correlated. But now that caloric intake is going down a little bit, or at least it's kind of leveling off, we're still seeing increases in weight. To my understanding, I'm not an expert here, but there seems to be something divorcing caloric intake from BMI. Are you seeing that same thing in, I don't know how much data, I'm sure there's probably a lot of data looking at this, but have you examined it?
Yeah. I can say in my patients, because my patients are kind of, it's an interesting, more of I would say a quote, select population that comes in who are already a little bit more holistically minded. So I have a very, very small population of, obese and overweight children. But yet I'm seeing this, where these kids, and it's really, I actually haven't tracked their calories, but I don't think it's about the calories. I really think it's about the sugar intake, because now the sugar that is insidiously entering into their diets. I mean, growing up for us, we didn't have Starbucks around every street corner or boba tea or, all of these. I mean, we had Coke and soda, right? But it wasn't just this, like, it wasn't a social thing to go out and get a sugary drink. And now, kids and teenagers and adults, I mean, nearly something like 50% of their sugar consumption is as sugar sweetened beverages. And so, and I know so many kids who are going out. I mean, as a social thing, I love the social connection, but they're going out and they're getting, like maybe a 52 grams of sugar mocha chip frappuccino almost every day. And I mean, that is
because of good marketing, right?
hugely
That's skewing
significant.
sort of how kids think about drinking.
Yeah. And that, of
sadly.
course, is going to directly alter the organisms that want to stay in your gut. I mean, we know about, candida and yeast overgrowth, but it's not just that. I mean, that amount of added sugar is going to directly cause inflammation. I think in some rat studies just can immediately cause signs of colitis. And so, and guess what? You disrupt your gut microbiome, you're going to disrupt your gut brain and gut immune and gut, metabolic connection. And so I think it's really that. And the number, when I was training, it was type 2 diabetes was not seen in children. It was called adult onset diabetes. I mean, we just
Right.
didn't see kids with it. And it's just all of a sudden, in the past, decade, a little bit more that, wow, we're having this explosion of kids with, we can't call it adult onset anymore because they're getting it even in middle school. So it's type
Sad.
2 right
Yeah.
now,